you were involved in the tragedy of 9/11 and some of the work that you did there.
I was the least experienced person there. So I had started my forensic training in New York City in July of 2001. So I had 2 months of training. I had July and August before September
wow.
11th happened. So that was my training ground.
This episode of the podcast is brought to you by Leap. Leap Legal Software is the leading provider of legal software for law firms and legal practitioners. Today's special guest on the podcast is a true crime junkie's dream. You have never met someone as interesting as my friend Judy Melinek, and we've been friends online for years now, Doctor, correct? 2 or 3 years.
We've been following each other and commenting on each other's videos for quite some time.
And I found Doctor when I was basically on my TikTok journey, and you don't get to meet many forensic pathologists, and you certainly don't get to meet many as pleasant and charismatic and funny as my friend. So before we get into anything, Doctor, why forensic pathology? It's such an interesting field, and tell us a bit about your story.
For me, it was not the first choice. I actually started training in surgery first. I was going to be a general surgeon, and I just couldn't work those hours.
Okay.
I found it draining and physically exhausting. And even though I liked the technical aspects of surgery, I like cutting things up and fixing them. The incredible abuse that most registrars or trainees get in the surgical process of learning how the apprenticeship, which is basically registrar training, is really it's too much, and I like sleeping a lot. That's when I discovered how much I like sleep. So pathology was my second choice. I did do pathology when I was a medical student. I took a year called a post-sophomore fellowship in pathology, which was a year interrupting medical school. So it was an intro to pathology. But I didn't take it seriously as something I would go into because I wanted to treat patients. And I thought that pathology did not really involve direct patient care. And it was only after I quit surgery and went to pathology that I realized that people don't know this, but pathologists actually do a lot of patient care. There are subspecialties, forensics being one of them, where you do have direct contact with patients. But in our case, those patients are not necessarily the decedent who you're doing the autopsy on, but it's their families. And that's where you get that doctor-patient relationship and where you get your satisfaction.
It's as I understand, you went to Harvard for your undergraduate. And then you did your did you become a surgical trainee, or did you and then you decided, hey, this program isn't for me, I want to go somewhere else? Or
yeah, so I actually went to Harvard undergrad. So in the States, where I trained, Harvard was my bachelor's degree, so that's a 4-year undergraduate degree in biology. Then I did 4 years of medical school at UCLA in Los Angeles. And during those 4 years, I took an extra year in the middle, so it was a total of 5, where I did pathology. Then I went and matched in surgery back at Harvard at Beth Israel Deaconess Medical Center, and I lasted for about 6 months. And it was just one of those kind of years where I just kept getting sick. I got first the cold, and I got the flu, and it physically wore me down to the point that I just could not I just needed a break in order to physically recuperate, especially from the flu. The day that I quit, I had a fever that was higher than the patient that I was operating on. And I called my husband at the time, my boyfriend, and I said, TJ, I said, I can't do this anymore. And I quit surgery and called up the Department of Pathology at UCLA and said, would you consider taking me back? And they said, absolutely, because I had done such a good job when I was a medical student. And so they took me back, and I was the happiest pathology resident ever because I could sleep and I could do medicine. But I was appreciative of the program and how much more, just the work-life balance as pathology is much better than in surgery.
And I mean, it's 10 years. I mean, you've put in 10 years. You've started this journey, and then you found that. And I'm a big believer of what's meant for you won't miss you.
Yeah.
And after I guess you specialize in pathology, what made you choose forensic pathology? And can you tell people a little bit, what is a forensic pathologist?
So I should explain what a pathologist is first. So the pathologist is that doctor that nobody really thinks about, but that actually runs all the laboratories of the hospital. So anytime you go to the hospital, if they say we're going to run some tests, as long as those tests don't involve x-rays or ultrasounds, if they involve any needles getting poked into you or any tissue being taken out of you, that goes to the pathology lab. So cytology, which is when you look at cells that are loose in fluid. Histology or surgical pathology, which is when you look at tissues that are taken out from surgery or through a biopsy. Even if they're just shaving a biopsy off of your skin to see if it's cancer, that goes to the lab. Hematology, where they're looking at your blood, urology, where, or testing chemistry, where they take your urine and you're looking to see if you have a urinary tract infection. All of those laboratory tests go to pathology. And there are two arms of pathology. There's anatomic pathology, where you're mostly looking at tissues and organs, as well as autopsies. That's where we do autopsies. And then there's clinical pathology, which is basically all the other laboratories of the hospital, including microbiology, looking for signs of infection. And the pathologists are the head in most hospitals of the labs, but also of the information technology for the hospital, because so many of the laboratory systems are technology-driven.
Wow. And so that's pathology. Right. And what is forensic pathology?
So forensic is a subspecialty of anatomic pathology. When you are training in the hospital to be a pathologist, you're doing autopsies only on patients from the hospital. So people who died in the hospital, but there's usually some medical question. It's not usually a question about why they died, but it tends to be questions along the lines of, did the cancer spread to all the organs? Or was the chemotherapy that we gave them effective, and to what degree? Those are the kinds of questions you typically are answering in a hospital autopsy. In a forensic autopsy, you are trying to figure out why a person died and what the manner of death is, whether it is natural, accident, suicide, homicide, or undetermined. So those deaths are deaths with legal questions, and deaths that are sudden, unexpected, and violent.
That's this is my world. We often read forensic pathologist reports when we're in front of the coroner, and the coroner is looking into the findings around what did and didn't happen, usually in some sort of horrific situation. And I guess before we delve into some of those situations, you have always had such a pleasant, happy disposition. Is this like a deliberate choice? Is this something that is common amongst forensic pathology? I must say you're the only one I know.
I would have to say that all pathologists are generally happy people compared to most other doctors. I think that Dr. Glockenflecken, who's also on TikTok,
he's the eye dude, isn't he? Yeah,
he is. When he depicts the pathologist as the one giving out cocoa and getting very excited when a medical student comes, we're all like that. We get so excited when anybody is interested in our field. So that is true. He totally nails it. When it comes to forensics, though, I have to say that anybody who works with death, whether it is forensic pathologists, people in hospice, end-of-life care, those people actually, amongst us, even people in the funerary industry, we find that we have a very life-affirming view of our professions, because every single day we're reminded of death. It's a memento mori. You come in and you see, oh, well, this is another way that people die, and it makes you just reflect on your own life and value what you have. You value that you woke up this morning. You value that you're married, that you have kids, that their kids are healthy, that even, every little thing you start to value because of what you do professionally.
I love that.
Yeah, because it could end at any time. So it makes you appreciative.
And I think that, just drawing on that a little bit, the work that you do, is it primarily for the defense? Is it for the prosecution? I mean, in the role that you're currently in, do you find you're doing both?
It is for both. Yep. So ultimately, our job is to speak for the decedent, because they can't speak for themselves. So by looking at the body, we can interpret the physical findings and then do it in as an unbiased a way as possible. And if the physical evidence that we're documenting is helpful for the prosecution, good for them. And if it's helpful for the defense, good for them. Sometimes it can be interpreted in more than one way. So the physical findings are there, they're documented, they're evidence, but their interpretation might be contingent on the scene and the circumstances and what information other witnesses or evidence brings to bear to the case.
Have you ever had a situation where you've kind of found yourself on both sides of the fence?
Oh, yeah, that happens frequently, actually. It's not unusual.
Share one. Tell us.
For one example is when I was at the San Francisco Medical Examiner's Office. I worked there for 9 years. There was a case of a man who had died. He was found deceased in a van where he was covered by a bunch of furniture. And the story that I was initially told was that he had gotten into a fight with another man, a neighbor, over a parking space and had been dragged into another house where he was apparently killed. He was being held in a chokehold as he was being dragged. And he was last seen in this chokehold. And so when I did the autopsy, what was interesting is that I didn't see any hemorrhage in the neck. Under the skin, there was nothing to indicate that he had any kind of neck compression. What he did have, which was really interesting, was there was a stab wound of his butt, and that one had no hemorrhage at all. So it was like somebody poked him with a knife after he was already dead because there was no blood circulating. But I didn't really find much of anything on him in terms of traumatic injuries. I think he had a broken nose, but there was nothing to really explain his death. So when the toxicology came back, and I believe it had amphetamines in it, I wrote a report that said that it was possible that it was an asphyxial death from that chokehold or blunt trauma from the broken nose, that he may have aspirated some blood. But I couldn't rule out that he didn't have a sudden cardiac arrest, meaning that his heart stopped while he was in the fight because of the amphetamines.
Yeah.
And initially, the way I wrote the report, it was because I couldn't really figure out exactly the mechanism by which he died. I knew it was a homicide. I mean, he clearly wouldn't have died if he hadn't gotten into a fight with the other guy. But I didn't know the exact mechanism in terms of what was the derangement. Is it in the heart, in the lungs? Was it the way he was positioned? Because I wasn't there. And there was no eyewitness to what actually happened after he got dragged in the chokehold. He was still alive the last he was seen. So it's interesting because I got called by the prosecution to testify, and I testified to my findings. And then after the prosecution rested their case, the defense put on the guy who had put him in the chokehold. And the story was that he dragged him in the chokehold, but then the decedent had gotten free and started fighting with him. He actually took a pipe and hit the defendant over the head with a pipe. So the guy was bleeding. And so the defendant then held him down. And while he was holding him down, all of a sudden he stopped moving. And he thought that the defendant thought that the decedent was faking it and wasn't even sure if he was alive or dead. And so he poked him in the butt with a knife to see if he was alive.
And that's how he got the...
And that's how he got it. And so after the defendant testified to what actually happened, then the defense called me again and presented it to the jury, presented that hypothetical to the jury that was just, and said to me, are these physical findings compatible with your autopsy report? And I said, yes, because they were. And so what was interesting is they did convict him, but instead of murder, they convicted him of manslaughter. And when the jury was interviewed after the trial by the public defender, they were mad at me because I didn't give them the answer. They wanted me to pick one side or the other.
Gotcha.
And I had told them that the physical evidence matched both scenarios, the scenario given by the prosecution, as well as the scenario that the defense gave based on the actual eyewitness's testimony, who was the defendant.
Wow.
Yeah.
I mean, this is something that I come across all the time. And, as much as I thoroughly enjoy those Law and Order shows and the Bones and the et cetera, they have created a real monster in the sense that people are just so confident in the science. And I don't think the science is as clear-cut as people think. Things are, I mean, in my world, we deal with a lot of DNA transfer. How did the DNA get there? The only way it could possibly get there is on there and see. And you don't know. There's actually a lot of ways for DNA to get to places. Has there been some unusual cases where you've kind of gone, wow, the truth is stranger than fiction? I wish fiction was the reality.
Yeah, I mean, I have so many of these. We're actually TJ Mitchell, my husband, and I. We write books together, and so we're writing some of these up for a proposal.
I love it.
For a book about these equivocal cases, these difficult cases, and it does come up quite a lot that the science is not absolute, that there are multiple interpretations of the physical findings, and those are the ones that go to court. Those are the ones that people have something to argue over.
Yeah.
It's not always a slam dunk case the way it's always portrayed on television. On television, they make the forensic
Yeah,
pathologist
absolutely.
out to be, someone who's almost prescient to the point that they can interpret everything down to the detail. And it's really, the science isn't like that. If you're truly unbiased, you have to be able to keep your mind open to the possibility that there might be alternate interpretations. Now, that said, there may be interpretations that are simply not credible.
Yeah,
we've all been
cases
as well.
Absolutely. We've all had to run that absurd
Yeah.
case. Oh, this is the
Yeah.
piano fell from the sky. Yeah.
Well, I mean, like I'll give you an example of a case where the alternate interpretation just didn't make sense. There was another case in San Francisco involving a shooting case where the eyewitness was up in a window right by a very, very bright light, and she claimed to have seen the whole shooting and identify the defendant by the fact that she was looking down on it from above. The problem was that her description of the shooting would require the gunshots to be going through the body in the opposite direction that they were actually going, and for the casings, which are ejected from the gun when someone shoots, to be in the street and not in the grass, which is where they actually were. So the physical evidence was diametrically opposed to her eyewitness testimony. And then the other factor that had to be considered was she's standing right next to a bright window and the decedent's body is in the dark.
Yeah.
So as you know, every time you are in the bright area, you can't see, your eyes are acclimated or accommodated to the bright light, and you're not going to be able to see past that into a dark area. So she was convinced that she saw it. She was not lying. I mean, she had seen something, but there was definitely manipulation that brought about this conviction unfairly, and eventually the defendant was exonerated.
I mean, if I could just do one thing for public consciousness, it would be to make people aware of how fallible memory is and how eyewitness testimony, while well-meaning, is often completely incorrect. And if things happen quickly, people don't process at the same speeds, and you just see all sorts of situations. But I guess this is when we're talking about the specific case. We were discussing, sort of before we came on, you were involved in the tragedy of 9/11 and some of the work that you did there. Could you share a little bit about what your role was at the time and sort of where you were at in your career and sort of what you were called on to do?
I was the least experienced person there. So I had started my forensic training in New York City in July of 2001. So I had 2 months of training. I had July and August before September 11th happened. And we were 30 forensic pathologists total for all of the 5 boroughs of New York. When 9/11 happened, Dr. Hirsch and Dr. Flomenbaum, the deputy chief, brought us into a room and basically said, this is not like anything you've ever seen before, but you've seen parts of it. So we want you to manage it. We do not want to bring outside pathologists in. And the expectation is that the 30 staff members of the New York City OCME would be the ones primarily responsible for all the identifications, cause and manner of death determinations for every single one of those decedents, which was over 2,700 people.
God.
And so over the course of my entire training year, in addition to doing my routine cases, we were also doing the recovery efforts for 9/11. And then while we were there, in about a month later in October, there was a plane crash. American Airlines Flight 587 crashed in Queens. So on top of the 9/11 mass fatality, we also had the incidents of the people who died from that plane, in addition to the people who were hit on the ground when it landed. So that was my training ground. That was my training year.
That is, yeah. That's a rough trot. That's a tired
It was.
apprenticeship.
But you know what? Even in the worst days, it was not as bad as surgery. I have to say.
Wow.
I kept reminding myself, like, surgery was way worse than this. Like, I can get sleep.
How do you even start? Like, you know, like identifying. Do you have a list of potential people and you work backwards? Like, what is the logic? How does the work?
Yeah, so it's both. So there are people who identify the people who are missing, the missing person. So usually that's done by police or by an identification division, depending on where you're situated, what your jurisdiction is. And they have a spreadsheet and a checklist of information that they need to get from the survivors who witnessed it or the family members who are missing somebody.
Yep.
So we do get a list of who's missing, and then simultaneously we are collecting the remains of wherever it is the disaster is and documenting everything that we see. So the focus is not, in many of these cases, on cause of death. It's pretty obvious what the cause of death was for 9/11, or, you know, if there's a fire, in many cases we know obviously it was a fire, and these are fire deaths and they were burned or had smoke inhalation. So you still try to figure out cause of death, but in most cases the focus is on identification. So if bodies are badly burned or crushed so that you don't have any external identifying features, then you have to look for things like X-rays, radiology. If they have any kind of prostheses or implants, that could be a unique identifier. If they're wearing any kind of jewelry or clothing that's unique, a lot of people have rings, for instance, that are inscribed with their name, or they have tattoos and marks that might be visible that we can help identify them. And ultimately nowadays it goes to DNA. So we collect DNA from every single decedent and then send that in, and that matches up the pieces if people are crushed to bits.
Wow. And I guess your relative is missing, you give your DNA and then they compare and contrast, or?
We can, but ideally what we want is it's easier to match a person to themselves.
Yep.
So usually in these kind of scenarios, the first request is that the family go back and get the person's toothbrush.
Really?
And that's the best because, you know, when you're brushing your teeth, you're also rubbing the inside of your mouth or an oral cavity, which is where we get a lot of really good cells for DNA. So if we can get the toothbrush or underwear of the person who passed away, it's better to match them to themselves than to try to match them to a next of kin.
I had no idea. So the toothbrush is the go-to modality.
Yeah.
And I guess when you're doing those sorts of that sort of work, do you have any are you the one that communicates with the deceased's family?
Usually in a mass fatality event, no. We try to keep things separate in order so that we can focus on it in a more kind of assembly line kind of way, which is different from what we do routinely when we're doing autopsies for the coroner. So when there's just a natural death and the family wants to know answers, they can go to the coroner and the coroner can put them in touch with the forensic pathologist to explain the autopsy report. And the same thing goes for attorneys, by the way. So if there's an attorney representing a family and they have specific questions that have legal consequences, they can just call up the pathologist who did the autopsy and ask those questions.
Yeah, wow. And I mean, I guess that in many ways, and this is, I think, the challenging thing for me, you are only giving difficult news in your role a lot of the time. You know, no one comes to you with anything relatively... I mean, well, actually, I take that back. I'm sure there would be some relatively positive stories.
Well, I've had some situations. I mean, I'm working in New Zealand now.
Yep.
I've been there for the past 5 years. I occasionally get things that are like washed up on the beach, and
Yeah, wow.
people think, "Oh, is that a tongue?" And then I look at it and I go, "It's got radial symmetry. It smells fishy. That's not human. that's some sort of marine life."
Oh, how good's that?
Yeah,
oh,
I know.
phew.
So it's really
People
amusing.
are freaking out. Hey, we've got their tongue. We got
Right.
their, and it's like, no, that's just a fish. Relax.
Yeah, I know. And I also had a heart that somebody had found, like an actual heart that was found near a graveyard. And I think it was probably left there as some sort of ritualistic thing. We did the DNA testing and it wasn't human.
Oh,
It's
thank
probably
God.
a sheep. Yeah.
Yeah, New Zealand sheep, that track. That tracks.
If there's bones found in New Zealand, 9 out of 10 times they're sheep.
Yeah, wow. And I guess, how do you have that conversation? That's it's more a philosophical question, but somebody's coming to you and they're bereaved, someone they love is gone, and you're just trying to explain, hey, this is how it went down. And
I got to say that by the time they come to us, they're usually open and ready for questions. So the
Gotcha.
immediate grief is past and they're ready and much more open. So all of the like anger, bargaining, all of the really hard part of the grief is usually in the first few days and weeks. And remember, when we do an autopsy, we don't get the results right away. It does take time.
yeah,
A typical autopsy I might do the day after the death, but then I won't get my microscopic slides for at least a week because of the processing through the lab, and then toxicology can take up to a month or two. So by the time I'm giving them answers, they're in a different place and they're more receptive and they're looking for answers. So in a way, it's kind of a really privileged position to be in as a physician, because it's like the worst has already happened. You can only kind of go up from there. So I'm there to give answers. I'm there to give closure. Like it's actually a really positive therapeutic relationship.
Can I ask what's the process of an autopsy? Like, how does it actually work?
So the beginning starts with just paperwork. We usually get information from the police or the death investigator, if it's in the States, that summarizes how the decedent was found, who found them, what their medical conditions are, if they have a history of drug or alcohol use. There's some basic questions that most investigative reports will cover.
Yep.
And they will sometimes also include ancillary reports like the decedent's medical records. So first we just read through the paperwork to have an idea about whether an autopsy even needs to be done. A large percentage of the cases that get referred to the coroner are people who die at home and the death is sudden, but it's not unexpected. It's, somebody in their 80s who has their first heart attack, or somebody, who has hanged themselves, for instance, out of suicide. So it's not a total surprise what the cause of death is, but our assessment is to try to figure out whether the decedent actually needs a full autopsy or what kind of a workup we need to do. And sometimes the family might object to an autopsy. In New Zealand, where I work, we have the ability to object to a postmortem exam if it is culturally offensive or, or the religious prohibitions. So the coroner will take that into consideration and ask us for our opinion if we think that an autopsy is still necessary. And so then we decide whether we can do an external exam, which is called a lesser postmortem, maybe a limited exam where we just look at the chest and abdomen, or a full postmortem, which we refer to as a 3-cavity exam. So that's head, torso, both chest and abdomen. And for that, the coroner has to give directions in New Zealand. In the States, I make the decision if I'm the medical examiner. But in New Zealand, I have to wait for the legal authority of the coroner to order me to do it.
Yep.
And then what we do is we take the decedent's body into the morgue, and it starts off with an external examination. So we just go from the head to toe, outside in. So look on the outside of the body, describe all the clothing and the property.
Do you dictate that while you do? Or?
I don't. I take notes and I dictate afterwards.
Yep.
I find that it's a little bit more efficient for me, but there are pathologists who will dictate on the body while they're walking around. But we're mostly looking at the external portions of the body just for signs of disease or injury, but also basic identifying features, the color of the eyes, the piercings, whether there are any tattoos or unique scars, whether they have a pacemaker or not, anything. And we just kind of go head to toe. And then after we do the external examination, then we put our paperwork to the side and we make a Y incision, which goes from shoulder to the middle of the breast and then down the midline to the groin, and peel off the skin, and then break the ribs using a lopper. Like to lop off branches from a tree. That's what we use.
Okay.
So you can get them at like Bunnings or in any of the hardware
No way.
stores. That's exactly
the
where
tool.
you buy them.
Okay.
That's
Yeah.
the tool.
Wow.
We don't use surgical instruments for that. We actually use a lopper because it's
it must be
really good.
physically heavy.
Yeah, it's heavy. So then you go up the ribs to remove the rib cage, and then you take out the organs either one by one or as one large block, which is called the Rokitansky procedure. different pathologists have different styles of doing this. I like to take the organs out one by one.
Yeah, okay.
And so each organ gets weighed, and the weight is important because if it's too heavy or too light, then the standard weights that we know that they're supposed to be for a person of that size, we know that there might be something wrong with it.
Got
So
you.
the weight is, so when you see an autopsy report and it says the weight, it's important to know what normal weights are so that you can signal whether that is a clue that something is abnormal.
Okay, gotcha.
Yeah, and then we slice the organs. Sometimes we slice them at about a centimeter apart and look at each layer to see if there's any pathology in there. Is there any cancer? Is there an infection? Are any prostheses in the right location, or have they moved? Anything like that. And then we document everything that we see. Some people dictate. I have a dry erase marker, so I just write it on a dry erase board and then copy it into my notes.
Wow.
And dictate later. And then we have in the autopsy report, we wait until we get everything back before we make our determination. So we'll have the anatomic findings from the autopsy, but then we send blood to the lab for toxicology. Sometimes we send urine too. We will send pieces of tissue to the lab so we can get it back under a microscope and can see under the microscope if there's pathology there. And there may be other ancillary tests like genetic tests we might send out, chemistry tests to test the vitreous to look to see if somebody's dehydrated or if they've got diabetes, if their blood sugar's too high.
You can tell that from the eyes?
You could tell that from the fluid in the eye called the vitreous.
Wow.
So after death, bacteria start to eat up the sugar in your bloodstream, so the bloodstream is not a good indicator of sugar levels. But the clear fluid in the eyeball is. So as long as the body's not decomposed, we could tell if somebody is in diabetic ketoacidosis. So these are all these tests that we run based on, in part, what we find in the body at the autopsy. And then when we get all the laboratory reports back, usually within about 2 weeks to a month, then we can sit down and finish the report. So in any given moment, a forensic pathologist is probably juggling, an average pathologist is juggling about 30 to 50 reports.
Wow. And how long does the process take?
So a typical autopsy, if you're taking just like a
average man or lady,
average person who dies of natural disease, it's going to be maybe 45 minutes to an hour just for the dissection part.
Yep.
Okay, so the external examination and internal examination. And then maybe another half hour to an hour to go through the paperwork and write the report.
Wow.
So total maybe 2.5 hours per person. But then there are the cases with intersection gunshot wound paths or multiple stabbings or beatings, and those are we refer to them as the 10% of cases that take up 90% of your time.
Can you tell us about a 10% case that takes up 90%? I want to hear about a multiple. I mean,
Yeah, so they're actually not the most interesting cases, to
Really?
be honest. Yeah, people always think, the murders, they're the most interesting. But for me, the most interesting cases are actually the therapeutic complications.
What do you mean by that?
So when someone comes into the hospital and they have medical treatment and then they die, there's often concern that the medical treatment may have killed them, that they died not as a result of their natural disease, but as a consequence of incorrectly applied therapy.
Yep.
Let's put it that way. So those are the most interesting cases to me. They fall into the medical malpractice realm for attorneys, but in many cases they're fascinating also because the reason they're referred to the coroner is because even the doctors at the hospital can't figure out why they died.
Yeah.
So I have a patient who's been seen by multiple doctors, who's had multiple tests run and therapies given, and nobody knows why they died, and it's a big mystery. So it's the stakes are high.
Yeah, wow.
And then now it's up to me to figure it out. I find those the most challenging, the most interesting.
And I think that when you're, I guess, it's like a nice academic problem, isn't it? In some ways,
Yeah.
it's interesting to see sort of the interplay of, well, how did this happen? And how did we get there? What do you think television gets wrong about your job?
Oh, God, so many things. Well, for one thing, they make us all seem really ghoulish or on the autism spectrum or something like that, like we can't, that forensic pathologists can't relate to people. And I find that the best and brightest forensic pathologists are actually people persons. Like they like people and they want to help. Just like most doctors, we're trying to figure things out and we're trying to give families closure. Like that's a really important part of what draws people into my field.
Yeah.
So that's number one is wrong, is they make us out to be either so scientific that we have lost our emotional or personal connections. The other thing that they totally get wrong is they don't show us testifying. So the typical CSI, 48 hours, whatever crime scene type shows focus exclusively on the pathologist in the morgue doing the autopsy, but you never get to see the consequences of all that, which is when it goes to court and that pathologist has to testify. I think the one rare exception of that would be Law and Order.
Yep.
Where you see the order part, so you get to see them testify occasionally. And
what about, I mean, I'm sure science has advanced considerably over the last 25 years, but, you know, is it an exact science, or is it much like law? It's an art form. I always say the law is not a science; it's an art form.
It's super science-y.
Yep.
It is scientific, but there is a real component of interpretation and experience.
Yeah.
So you do rely on science to make your final diagnoses, but you have to couch that with the fact that the science it's not an exact science. It's not like something like physics where you can do the maths and figure out what's going to happen. In forensics, there may be multiple different ways to interpret the physical findings, and that both of them are valid, like the case and example that I gave you. And there are also some things that are unknowable because autopsy is an imperfect procedure. It can tell you anatomy. It can tell you what's anatomically wrong with the body, like the heart's too big or the kidneys aren't working. But it can't tell you physiology, which is why it didn't work at that particular moment. So, for example, let me give you an example of this, is epilepsy. A lot of people who are epileptic have perfectly normal-looking brains. Like if you get their brain and you take it out and you slice it up, it looks perfectly normal. On a CT scan or MRI, it's perfectly normal. It's only not working well when they're alive, and it's not firing properly. The electrical impulses are not being conducted properly. Once they die, there are no longer electrical impulses. I can't see that once they're dead.
Got you.
So I can't see an epileptic seizure.
Got you.
Once a person is dead, I can look at their medical records and there's documentation that they had epilepsy. I can sometimes find a bite mark on their tongue if they bit their tongue while they were having a fit, their final epileptic seizure. But in the absence of those findings, I'm not going to see the seizure once they're already dead.
Yeah.
I have to back into it. So I do a full autopsy. I do toxicology. I don't find any other reason for them to be dead. And then I rely on their medical history to determine the cause of death.
It's much like what we do. We have, you start out with all these multiple possibilities, and then you slowly close the door on this, and this, and and you're always playing defense, I guess. You're never going to have all the answers.
No, you're not. And you're constantly second guessing yourself. And sometimes you have to, when you testify, get the juries comfortable with the idea that some things are not knowable. So that, to me, that case that I told you about where the jury was mad because I didn't tell them who was right, I took that as the greatest approbation of my testimonial skills, because that's not my job. My job is not to tell them whether he's guilty or not. That's their job. My job is to explain the science to them. And the fact that they understood that the science was not going to answer the question is what they needed to get from that.
Yeah, and it really is. Juries really think that you'll have trial by scientists. You'll get two scientists side by side, and one will say A and one will say B. And I've found that often experts, they're very rarely. Even if they disagree, they'll say, I disagree because I think the underlying facts are this. But they respect one another's ideas and the way that they approach the problem. And you were saying something earlier about you want to get these down on paper, and you're a writer. Tell us a bit about that.
Yeah, so after I trained at the New York City Medical Examiner's Office, I had kept a journal, a diary during that time. And my husband, TJ Mitchell, it was an English major at Harvard.
Love it.
I was the biology major, he was the English major. And I just handed off my diary to him and I go, here, you do something with this. And then it took us about 10 years to finally collate it together and figure out how to work it into a book, and that became Working Stiff. So Working Stiff is a memoir based on my notes from my training at the New York City Medical Examiner's Office. It includes 9/11, but that's not the primary focus of the book. The primary focus of the book is what does it take to train to be a forensic pathologist? So it's a lot of different cases that I learned from while I was in training.
I'm biased. I think that medical professionals' memoirs are the best. I really like. I skimmed yours. I didn't have a chance to finish it, but I did skim it, and I'm about a third of the way through, and it was fantastic. I really like "This Is Gonna Hurt" by Adam Kay. I think
that's a great
it's
one
a
too,
great
yeah.
one, and I like "The Examined Life" by Stephen Grossman. He's a psychologist who talks about what his patients who were very unwell taught him about life. I think that it's fantastic. And you now work in New Zealand. You now, what does the future hold?
Well, we've also written 2 books which are novels. One's
Okay.
called First Cut and one's called Aftershock, and they're loosely based on actual cases I did as a San Francisco medical examiner. So we do want to do more writing, both nonfiction and fiction. We have a book proposal in the works now based on my consulting practice. So that is what I do. I do medical legal consulting both in the States and in New Zealand. In the States, it has to do with both criminal and civil cases. So attorneys will come to me and ask me for second opinions on wrongful deaths or criminal matters. And then in New Zealand, I am the chief forensic pathologist for Communio, which is a company that is contracted with the Ministry of Justice to do autopsies for the coronial system.
Wow.
And there I'm in charge of supervising 5 mortuaries in New Zealand.
And do you do a lot of testifying before the coroner?
I do, both for the coroner in New Zealand as well as for the Crown prosecutors when it's a criminal matter, and then also in the States for both civil and criminal cases.
Do you get nervous when you're being cross-examined?
It's gotten better. I mean, obviously, everybody gets nervous. It's like any other performance review,
Yeah.
because you're going to have to be able to defend that the work that you did. But we just remind ourselves that I'm not on trial, and really, my goal there is to explain the science to the jury so that they can make the decision. It's not my decision; it's their decision. So I'm successful if I can explain the science in such a way that they can then use that information to do what they do.
And as someone who I guess has my view is the jury system is remarkable, and often you get 12 people that individually maybe would get it wrong, and you put them together and an alchemy happens. What would you say about the jury system?
It really depends so much on the jurisdiction. So if you are in a jurisdiction where people are really engaged in it and aware of the science and well-educated, I think you can have excellent decisions being made by a jury. But if there are extreme passions, if politics plays into the mix, if there's racial animosity or bias, I think that those feed into the jury system as well. Nobody's immune from those kind of pressures. And I think that that's where I see the jury system fails, in my perspective, when there's politics, racial injustice, those kind of things feed into the jurors' biases.
Yeah, but you're right. You're right. And the jury is a cross-section of society and of the times. And what would you say to the young listener who thinks, this sounds awesome and I want to do this? Would you, if you had your time again, would you become a forensic pathologist again?
Oh, absolutely. I love this job. I look forward to doing it every single day. I'm always, even when I'm writing my reports, I just take a break and go, oh my God, this is so cool. It's really funny. And I was not expecting that. That's almost shocking to me that I'm still, I'm in my 50s now. I've been doing this for 25 years and I still look forward to doing it. I don't want to ever retire if I can avoid it. I just enjoy doing what I do so much. And it gives me such fulfillment. Like, I feel like I'm actually contributing something really positive.
You absolutely are, and as a legal professional who has read more than my share of forensic reports, we're very grateful to have you. Where could people find more information about you?
Oh, easy to find me. I have a website, which is pathologyexpert.com. So if you want to consult me on any legal aspects in the United States or Canada or anywhere on that part of the globe, that would be through pathologyexpert.com. In New Zealand, I can be reached via Communio. And then I'm online on all the socials. So it's Dr. Judy Melinek on TikTok, on Blue Sky, on what others? Facebook. The only one I'm not on is the one that Musk owns.
Yeah.
Avoid that one.
I can tell you right now, if you're following my TikTok and you're not following Dr. Melinek's, you are missing out. She is the best. It's been such a delight to speak to you. Thank you so much for coming on the show. And, I'm grateful people like you are doing the work that you're doing, because it really does. As someone who's been there on the, besides people as they're going through coronial inquests and what happened, it means the world. So thank you.
I appreciate it. Thank you for inviting me. It's great to talk to you.
Perfect. Thanks.